A bit of a spoiler alert here. The answer to this question, should I self-prescribe, is pretty obvious. The answer is no. But the reason why I'm making this video is because I have come across situations where I'm speaking to either fellow colleagues or patients come to see me and they are doctors, and they in passing tell me that they have prescribed themselves something that has really helped them for whatever reason. And having trained in the UK, where I feel we were very guideline and protocol driven, it was obvious no one would ever self-prescribe. And there were even stories of a doctor once doing a prescription for some antibiotics for herself a few years ago. And the moment she went to cash in that prescription at the pharmacy, within literally 5 to 10 minutes, she got a telephone call from the GMC, which is the General Medical Council, which is the equivalent of AHPRA here in Australia, asking her why she felt it was appropriate to prescribe herself some medication and gave her a warning straight away. I feel that things are changing here in Australia, and the longer I'm here, the more I'm realizing that a lot of effort is being put into helping doctors realize that self-prescribing is an absolute terrible idea, and I will go through the 3 main reasons why self-prescribing is not a good idea. Now, the first reason, and this may seem counterintuitive for a lot of doctors, is there is a lack of objectivity. As a doctor, and I know this on my own example, and this is going to sound really strange what I'm about to say, I feel that I am a good doctor in the sense that I read loads of guidelines. I have made a video of the 7 websites that I open every single time I start my clinic, which is effectively all guidelines. Anyone that comes into me, I will go through the guidelines with them. What is evidence-based medicine, and how are we going to treat this condition that we're dealing with? And so realistically, if I feel like I'm dealing with a certain condition as a human being, not as a doctor, well, I know the guidelines, I kind of know what I should take, and so why wouldn't I just give me the medicine that the guidelines clearly say I should be taking? And the problem that I start seeing in doctors who do self-prescribe or do request their own tests or own investigations is that you didn't get the basics of a good medical history. And there is an art to taking a history from someone. So when someone sits down in front of me, I will take a history and I am objective, and there's no emotional involvement here, and I am not subconsciously gearing my symptoms into a certain diagnosis that leads to those guidelines that I was talking about previously. And so I've seen a lot of doctor patients come into me and they have, let's say, a shoulder complaint, and they've had crazy nuclear medicine scans without just doing the basics of just seeing a physio for a few days. And I'm just like, let's just take things back to basic. Let's get into a position where you don't feel you need to treat yourself. And that could be through bad experiences with other doctors. And let me just take over that responsibility. Let me be your doctor. Let me guide you through the guidelines and the processes, and you will have a better outcome. So it is effectively the personal biases that can cloud our judgment, leading to a misdiagnosis or effectively unnecessary investigations. And that is very common in people who have a condition that can be easily managed by their GP, but they are effectively a hospital doctor. And a lot of things in hospital are not common things, and there's often a very heavy-handed approach to managing those conditions that in the community in GP can be managed in very simple ways. And I'm not just saying that hospital doctors are at fault here. GPs as well, even if they have a simple GP complaint, should see their own GP, who again will take that history in an unbiased way to get to the right diagnosis. Now, number 2, and this is where you'll see a lot online from your medical defense organizations, is the risk of overuse or misuse. And we're talking specifically about Schedule 8 drugs, benzos, sleeping tablets. I can see that happening less and less because there's so much information from our medical defense organizations, from AHPRA, that we should not prescribe Schedule 8 drugs to ourselves or drugs of dependence. And this is an article from November 2023, so it is a little bit older. And I found this on the Avant website. I'm currently a member of Avant. I've had a pretty good experience with them so far, and they have a lot of really useful articles about self-prescribing. So what they are describing here is a doctor's husband had surgery, and they were at home and they had some post-operative care and they wanted some stronger painkillers. And so rather than telling that patient, well, you need to speak to your doctor, that doctor felt, listen, let me just help my husband out here. He's in a lot of pain. I'm just going to do a quick prescription for him. And the mistake that she did, apart from trying to treat your own family members, which we will talk about as well, is rather than creating a separate file for her husband in the clinical systems that she was using, she just quickly printed out a prescription in her own name, which effectively also means that she had her own patient record file in her own GP practice's clinical system. And what happened is that we have a prescription monitoring system that I have spoken about before. And if you want to learn how to use script check in Western Australia, because that's the monitoring system that we use, I will leave a link to a video that I have made previously. And then effectively effectively what happened is that she also got a notification from the regulatory bodies here in Australia, from AHPRA, saying that does she know that the Good Medical Practice Guide clearly says you may not self-prescribe, and she got in trouble for it. And another side to this point is that sometimes doctors unfortunately can get addicted to drugs that they prescribe for themselves. We know that is the case with patients in general, which is why we're trying to avoid Schedule 8 prescriptions for non-chronic cancer pain in general, and we generally just use opioids for acute pain. There are a lot of drugs out there that are terribly addictive, and you would start with a small dose, and if continued for long enough, you get addicted to them. And as patients are starting to realize that more and more doctors are really not perpetuating those prescriptions, and if you are interested in the video that this pertains to, it's how to legally prescribe Schedule 8 drugs, it's getting harder and harder to get these prescriptions from doctors. So unfortunately, a few doctors have got into a difficult situation where maybe they did go to see their regular GP and they just wanted to continue that script of the oxycodone that they had for their back pain. And their regular GP was like, listen, this probably isn't a good idea. We should get you onto something safer. But they were addicted at that point and they started perpetuating those prescriptions. Again, that is getting rarer and rarer. Now doctors, through prescribing monitoring systems, through loads of articles, are aware that you just can't do that to yourself anymore. It has happened historically. And so this is another reason why you wouldn't self-prescribe. And now the third reason is a reason that we kind of already alluded to. The main, most obvious reason is that you're not allowed to. That's pretty straightforward. And it says everywhere that you're not allowed to. Avant will have many, many brilliant articles about this. One of them is the Prescribing Safely article, where the Good Medical Practice, a code of conduct for doctors in Australia, clearly says that good medical practice involves ... not self-prescribing. And if you do want to read a few more of these articles, I just put in Avant self-prescribing in Google, and you can see that there are a lot of articles here about doctors getting in trouble for self-prescribing. Doctors sanctioned when self-prescribing, general practitioner reprimanded and fined over self-prescribing, prescribing essentials, not self-prescribing. So yeah, there's a lot of information out there that will tell you that it's just not a good idea to self-prescribe. There's really no reason nowadays why anyone would self-prescribe anything to themselves. I hope that makes sense. If you have any issues or you want to leave a comment below, feel free to do that under this video, and you can also email me directly. Again, if you are in a situation where you are struggling with either substance abuse, you are self-prescribing, and you have become addicted to some of the drugs that you have given yourself, make sure to reach out to someone. I think nowadays there are a lot of support systems in place to try to help doctors who are in those tricky situations. And if you do want me to leave a few links below for some doctor advisory services, I can also do that. Feel free to leave a comment below and I can do that for you. And I hope that makes sense here.